Are you looking for a career in radiography, radiation therapy, magnetic resonance, or medical dosimetry? If so, you will want to ask the question, is the program accredited by the Joint Review Committee on Education in Radiologic Technology? What is accreditation and why is JRCERT programmatic accreditation so important? What is accreditation and why is it important? The United States Department of Education defines accreditation as follows. Accreditation is the process used in U.S. education to ensure that schools, post-secondary institutions, and other education providers meet and maintain minimum standards of quality and integrity regarding academics, administration, and related services. The Joint Review Committee on Education in Radiologic Technology is a not-for-profit organization that sets standards for the education of professionals in the field of radiologic science and evaluates educational programs against those standards. Approximately 700 radiologic science educational programs are accredited in the United States by the JRCERT. For more than 50 years, the JRCERT promotes excellence in education and elevates the quality and safety in patient care through the accreditation of educational programs in radiologic sciences. The JRCERT is the only organization recognized by both the United States Department of Education and the Council on Higher Education Accreditation to accredit educational programs in radiography, radiation therapy, magnetic resonance, and medical dosimetry. JRCERT accreditation is the hallmark that tells students, patients, and public that you value academic excellence, quality health care, and patient safety. Accreditation can be divided into two categories, which are institutional or programmatic. Institutional accrediting agencies set standards for colleges and universities and evaluate those institutions holistically according to regional standards. In 2020, the United States Department of Education combined regional and national accreditors into one known as institutional. Institutional accreditation is not intended to address some of the specific elements of programs in the radiologic sciences that are essential to assure the level of educational quality identified by the profession. Specifically, institutional accreditation does not involve review of the clinical component of the educational program, verification of adherence to the recognized professional curriculum, and evaluation of clinical faculty and preceptor qualifications. The value of JRCERT programmatic accreditation is important for various communities. For students, accreditation assures their chosen educational program will provide the knowledge, skills, and professional values required to provide safe, high-quality diagnostic and therapeutic radiologic services to patients. For employers, JRCERT accreditation provides assurance that new graduates and subsequent employees have completed a curriculum that covers the essential knowledge and skills required for today's fast-changing workplace and profession. For educational programs, accreditation provides an external benchmark to assure programs are meeting minimum standards identified by the profession while countering any pressures to compromise program integrity and also assists programs in attaining equitable access to institutional resources. Professional accreditation through the JRCERT assures that the profession maintains a consistent, minimum level of didactic and clinical education for all new practitioners. Most importantly, for patients, JRCERT accreditation ensures that care provided by students will be appropriately supervised and that graduates will have the appropriate knowledge, skills, and professional values expected of a qualified practitioner. Assessment and analysis of the educational programs is instrumental to JRCERT accreditation and includes a comprehensive on-site visit by peer reviewers from the applicable discipline who volunteer their time to assure educational quality, as well as a review and evaluation of the programs by the JRCERT Board of Directors. The Board of Directors are comprised of volunteers from the profession and are nominated from the following organizations: American College of Radiology, American Association of Medical Dosimetrists, American Society of Radiologic Technologists, American College of Educators in Radiologic Technology, Association of Educators in Imaging and Radiologic Sciences, Association of Healthcare Radiology Administrators, and one member from the public. The Board of Directors are the ones responsible for all accreditation decisions and awards. The culmination of the accreditation process is the actual accreditation action. JRCERT staff does not determine accreditation awards. Accreditation decisions are made by the JRCERT Board of Directors, which meets in person twice per year and holds conference calls nearly every month to determine accreditation actions. The types of awards include initial accreditation, which is a program applying for JRCERT accreditation for the first time, and continuing accreditation, which is a program's application for maintenance of its JRCERT accreditation. The maximum length of an initial accreditation award granted by the JRCERT is 3 years. The maximum length of a continuing accreditation award granted by the JRCERT is 8 years, with an interim report required after the first 4 years. Probationary accreditation may be awarded when an accredited program is subsequently determined not to be in substantial compliance with the relevant accreditation standards. Probationary accreditation is usually limited to 1 year and may not extend beyond 2 years. The most severe accreditation award is involuntarily withdrawn of accreditation or withheld initial accreditation status. This generally occurs when a program cannot meet compliance with the standards and has been on probation and/or a compliance timeframe. The criteria used to determine this action may be accessed on the JRCERT website. This action may be appealed by the program. Finally, a sponsor may withdraw from accreditation at any time in the accreditation process or during the accreditation cycle. Generally, this occurs when a program decides to close. Accreditation decisions are posted on the JRCERT website. If you have questions regarding the accreditation status of any program, please contact the office. To find out more about programmatic accreditation in the radiologic sciences, please visit other areas on the JRCERT website. Thank you for your inquiry into programmatic accreditation.